Our group case study was on Little Bo Peep, and the group participants were Shannon Althizer, Jan Carroll, and Sandra Murphy of Montreat College. The key points for consideration in the case of Little Bo Peep are that she has been seeing her counselor for about 1 month. Little Bo Peep is a 17-year-old adolescent whose parents do not know she is coming to therapy. She has been unable to sell her sheep's wool and has asked to barter sheep as payment for counseling services. Little Bo Peep has discussed with Shepherd her strong relationship with the sheep and being anxious and afraid when she does not know where to find them. In the case of Little Bo Peep, our group chose to use the feminist model for ethical decision-making. The feminist model for ethical decision-making combines the rational evaluative model, emotional and intuitive aspects of the clinician's response, awareness of power differences between the client and the therapist, and the recognition of possible cultural biases. When applying the feminist model for ethical decision-making, the first step is the recognition of a problem. In the case of Little Bo Peep, the first recognizable problem was the lack of parental consent, which is necessary in this case because Little Bo Peep is only 17 years of age. Recognition of any ethical dilemmas includes not only rationally examining the case, but also evaluating emotional responses to the case that the counselor may have. Some of the emotional responses that were evoked were fear because of legal implications, curiosity as to why Little Bo Peep has not informed her parents of her need to seek counseling, and uncertainty of how to proceed. There is an ethical conflict because no informed consent has been signed by Little Bo Peep's parents, and she is a minor. Consultation would definitely be sought after by other informed professionals. The other recognizable dilemma in step 1 is the bartering for services. Little Bo Peep wishes to exchange her sheep in exchange for counseling sessions with the counselor. The counselor would most likely start to begin experiencing feelings of anxiety the second bartering was mentioned. What makes this predicament even more troubling is the emotional attachment that Little Bo Peep has with her sheep. Bartering is not a common or acceptable practice in the professional community. Consultation should be sought from a respected, more knowledgeable colleague, and each ethical dilemma discussed fully. Any suggestions will be taken into consideration when formulating solutions. In the feminist model for ethical decision-making, the second step defines the problem. When defining the problem, it is imperative to look at any ethical principles, obligations, laws, or treatment imperatives that may be at odds. In this step, it is also important to take into account the needs of all of those who are involved. This step also requires collaboration with the client on both rational and emotional dimensions. In the case of Little Bo Peep, there are several ethical principles in conflict. There is also a conflict with the state of North Carolina statutes. The people involved who need to be considered are Little Bo Peep, the counselor, and Little Bo Peep's parents. When it is appropriate, the feminist model encourages the involvement of the client at all stages. Therefore, Little Bo Peep needs to be involved in every stage of the decision-making process to which it is appropriate. During the collaboration with the client, the emotional dimensions evaluate emotional responses of both the client and the therapist in regards to culture, previous experiences, and response to the ethical dilemma present. The client has expressed an emotional attachment to her sheep that the counselor recognizes on an intuitive level. Relinquishing one of her beloved animals would likely result in harm to Little Bo Peep. In accordance with the rational dimensions in the second step, these ethical issues must be discussed with the client openly and honestly. The counselor must be conscious of possible imbalances in power that may be present because of age differences between the counselor and the client. A bartering relationship between the counselor and Little Bo Peep is counterproductive for several reasons. Since bartering may prove harmful in this instance, the practice violates the moral principle of non-malfeasance. A violation of an additional moral principle of justice is also possible if the exchange of services is not equitable. In the case of Little Bo Peep, the first relevant standard is North Carolina Statute 48A-2. This statute considers anyone less than 18 years of age a minor. The other two standards come from the American Counseling Association's Code of Ethics. Section A-2D, the inability to give consent, states that when counseling minors or persons unable to give voluntarily consent, counselors seek the assent of clients to services and include them in the decision-making as appropriate. Counselors recognize the need to balance the ethical rights of clients to make choices, their capacity to give consent or assent to receive services, and parental or familial legal rights and responsibilities to protect these clients and make decisions on their behalf. Section A-10D, bartering, states that counselors may barter only if the relationship is not exploitive or harmful and does not place the counselor in an unfair advantage, if the client requests it, and if such arrangements are an accepted practice among professionals in the community. Counselors consider the cultural implications of bartering and discuss relevant concerns with clients and document such agreements in a clear written contract.
Step 3 of the feminist model involves developing solutions to the ethical issues that have been identified. The first discussion will be possible options for responding. The parents of Little Bo Peep must be consulted about their daughter's therapeutic needs and provide their consent before counseling sessions can continue. This issue may be resolved by a private discussion between the client and her parents, or an invitation to meet in conference with Little Bo Peep and the counselor so they can be informed of their daughter's therapeutic sessions and possibly give their consent. The second ethical issue concerning bartering presents possible harm to Little Bo Peep, but alternatives do exist. Since the ACA Code of Ethics 2005 encourages counselors to devote a part of their services at little or no charge, the counselor may set up payments for services rendered that are based on a sliding scale calculated on Little Bo Peep's ability to pay. Or the client may offer services to Little Bo Peep on a pro bono basis. Still another option, the counselor may refer Little Bo Peep to a free or low-cost counseling practice in her community offering comparable therapeutic practices. Cost-benefit analysis of these options involve the fact that Little Bo Peep's parents may refuse to allow counseling services once they're informed. Another cost-benefit analysis involves the bartering system. If Miss Peep is referred to a different counseling service, the current counselor must be mindful of the ACA Code of Ethics 2005, Section A11D, which instructs counselors to make sure the transfer process is complete and that clients' needs are always met by the new counselor. Practical and prudent solutions involves the fact that Little Bo Peep will discuss possible resolutions to both ethical dilemmas. If future complications occur, or the counselor and the client are unable to reach mutual agreed upon answers, further consultation with one or more professional colleagues may be pursued to find additional solutions. Step 4, choosing a solution, is designed to reflect on all the decisions that are made and make sure they meet all involved parties' needs. We look at both the cognitive and emotional components, and we also make sure that it fits rationally and emotionally. The decision to obtain informed consent from Little Bo Peep's parents by inviting them to a conference with their daughter will provide emotional support for Miss Peep as therapy is discussed, and it will allow the parents to meet the counselor. The formulation of a sliding scale payment schedule will meet the counselor's financial needs, and Miss Peep will feel invested in the therapy process. The counselor employs emotional and intuitive processes to reflect on how she would feel if she were in the place of Miss Peep. She chooses the option that feels right to her after consulting trusted colleagues and Miss Peep. Step 5, reviewing the process, allows the counselor to review the decision-making process and determine how her values and personality have affected her ethical decisions. Is the right decision being made? And the client's reaction to the chosen solution must be taken into account. The counselor recognizes that legal requirements of North Carolina compel her to obtain informed consent from Little Bo Peep's parents. Her decision to set up a discussion with all involved parties is influenced by the counselor's desire for open discussion and honesty. She also realizes that her values have led her to implement payment schedules for Miss Peep. While she could have offered free services, her intuitive skills lead her to believe that payment for services invests the client in the outcomes. After informing Little Bo Peep of her decisions, the counselor gives her an opportunity to express any reactions to them. The counselor takes Miss Peep's input in careful consideration before implementing the ethical decisions.
In step 6, after discussing the issue of parental consent with Little Bo Peep, she agreed to invite her parents to the next session so the counselor and Miss Peep can explain therapeutic activities to them. After hearing about their daughter's needs and the counselor's efforts to address them, the counselor and client are hopeful the Peeps will sign an informed consent agreement so Miss Peep's therapeutic sessions may continue. The first ethical issue concerning obtaining consent for Little Bo Peep from her parents may result in the refusal to give consent for therapy and the resulting termination of the client-counselor relationship. Such termination may prove harmful to Miss Peep. However, ethical counselors are expected to follow legal statutes when conflicts exist between these laws and ethical considerations. Little Bo Peep, after discussing and recognizing the potential for harm that may result from a bartering agreement, will be presented with a payment schedule established by the counselor based on her salary and ability to pay. The counselor will explain that financial matters will be revisited at the end of each month as long as therapy continues. Any further developments in the wool market, whether positive or negative, will be openly discussed at that time. The ethical dilemma involving Little Bo Peep's financial issues and desire to barter can be resolved simply when the counselor is willing to forego remunerations for the sake of the client's welfare. Little Bo Peep should never be made to feel at a financial disadvantage in the client-counselor relationship. She should be reassured that the counselor will not feel cheated and that she is not receiving charity. Cultural considerations concerning such financial relationships must be attended to so Little Bo Peep feels valued as a person. Step 7. One of the learning experiences in this dilemma would be to never start counseling sessions with a minor that has not had a parental consent form signed. This would eliminate the issue of counseling a minor without a parental consent, and the experience can be used to prevent future dilemmas. The counselor may be inclined to eliminate bartering from their practice, but because of the cultures that use bartering as a common practice, the counselor hesitates to take such a drastic step. However, she will only consider bartering in the future if culturally motivated. As with each ethical dilemma that presents itself, there is always something that is taken from the situation to aid in future decisions.